Hello, everyone. I think we'll get started just to keep us on track today. So welcome to another session of our Global Speaker Series related to post-secondary student mental health research. It's part of a continuation of a virtual event series developed as part of the Global Research Network, of which the founding universities are University of Toronto, King's College London, National Taiwan University, and the University of Sydney. It was funded by Connaught Global Challenge Award here at the University of Toronto. The goal of this speaker series is to provide the opportunity for faculty, staff, and students at all levels to present their interests and expertise in the interdisciplinary field of post-secondary student mental health. Additionally, we want to provide knowledge generation, dissemination, and expansion to the field of global student mental health. Please note that the feedback form will be shared following the session. We invite all attendees to complete this form to support our future planning of the Global Speaker Series. It is my pleasure to introduce our moderator for today, Professor Julius Haag. So personally, he has worked very closely with us over the last couple of years as the Associate Director of Teaching and Training for Inlight. Julius is an assistant professor in the teaching stream in the Department of Sociology at the University of Toronto, Mississauga, where he teaches courses in policing, urban life, public policy, and youth gangs. He has contributed to several campus-based initiatives, including as the session lead for race-based data collection at the National Dialogues and Action for Inclusive Higher Education, and as a review panel member for the U of T review on the role of campus safety services in student mental health. His research interests include policing, youth justice, gangs, racialization, ethnicity, criminalization, and teaching and learning. It's with great pleasure that I introduce Julius, who will take it over from here.
All right. Good morning, everybody, or good day to wherever you are in the world. Kristen, thank you so much for that kind introduction. Welcome all. So today's session is a panel discussion entitled Exploring Strategies and Practices for Campus Community Partnerships to Support Student Mental Health and Wellness. I'm really excited today to be joined by Myra Fahim, Assistant Director of Health Promotion and Evaluation, Health and Counseling at Evaluation at the Health and Counseling Center at UTM. Sandali Vithanagae, who is Vice President of the UTM Mental Health Student Association, and Aden Ahmed, an MA student in Global Mental Health and Counseling Psychology, and a member of our Inlight Student Advisory Committee. So we're going to have a panel discussion today. At the end of the panel discussion, we'll have a Q&A session where the audience, you'll be invited to ask our presenters questions. So to do this, you can use the Q&A function, which you'll see on your screen. It's different from the chat function. And this will just allow our colleagues who are coordinating the Q&A session to see your comments and your questions here as well. The questions will be then sent directly to the speakers. You can share questions at any time, but we'll address those questions at the end of the session. So I'd like to begin by introducing our panelists who are going to be joining us today. And they're going to be appearing here on your screen. So I'll start off with Myra. Myra Fahim received her honors BSc from the University of Toronto and a Bachelor's of Education from Queen's University. Additionally, she holds a Master's of Science in Psychology and a Master's of Social Work. Myra has been working in the mental health and addictions field for almost 15 years and is currently the Assistant Director, Health Promotion and Evaluation within the Health and Counseling Center at the University of Toronto, Mississauga. In her role, she oversees health and well-being outreach and education to students while supporting broader quality improvement initiatives. She also has a private clinical practice where she largely supports youth and young adult clients and is a mental health consultant providing support for program development and facilitating trainings focused on workplace mental health as well as crisis intervention and de-escalation. Welcome, Myra. Sandali Vithanagae is a fourth-year student at the University of Toronto, Mississauga, specializing in sociology, with plans to pursue a master's degree in sociology at the University of Toronto this upcoming fall. Very excited to have Sandali joining our program. Sandali has been involved with the Mental Health Student Association at UTM for the past 2 years, starting as the creative director in her third year and currently serving as the vice president. Through the work of the club, Sandali has seen firsthand the impact of creating events and spaces where students can step away from academics and recharge, seeing how vital mental wellness is at UTM and why it's something we must continue to prioritize. And Sandali hopes to carry this passion forward through research, community engagement, and legal advocacy. Welcome, Sandali. And last but certainly not least, Aden Ahmed is a Master of Education student in Counseling, Psychology, and Global Mental Health at the University of Toronto's OISE, with a BA in Psychology from the American University of Beirut. He is deeply committed to advancing mental health equity for refugee and immigrant communities. Aden brings frontline crisis support and expertise to his roles in student mental health, research, and community care. He currently serves as a student advisor both within Light and as a case manager for Fred Victor supporting African, Black, and Caribbean populations in Toronto. Welcome, Aden. So we have a wonderful panel today, and I think a really great representation of folks from different sections and aspects of our U of T community as well. So that's where I want to get the ball rolling today, and maybe just hear a little bit more from our panelists about background on their work and their experiences. So specifically, I want to ask us to the group here about your involvement with the U of T community, and specifically how this intersects with student mental health and wellness. And I'll get the ball rolling, passing that over to Aden. So Aden, you're one of our student advisors for Inlight, but you also work as a case manager for Fred Victor. And I know you have other involvement with mental health and wellness in our U of T community. Maybe you can tell us some more about that work.
Yes, so thank you for having me. And as someone who has navigated both the academic and the community mental health spaces, I am deeply passionate about initiatives that are geared towards building systems that are truly see and support students, especially those folks who are facing complex life transitions, including immigration, academic stress and burnout, and at times financial hardships. And for your question regarding involvement with UFT and mental health, currently I am a graduate student at OISE and studying counseling psychology and global mental health. And I'm also a member of the student advisory committee this year at Inlight. Our work is basically advising on mental health equity, accessibility, and knowledge mobilization across the three UFT campuses. And we do provide input on campus-wide student wellness strategies, review research tools, and ensure that equity, diversity, inclusion, and accessibility principles are embedded into the student mental health programming. At the University of Toronto, Mississauga, me and two other graduate students were acting as wellness ambassadors with the Health and Counseling Center, and I collabed with those folks in specifically targeting mental wellness workshops, and we did create a peer-led mental health education events and also promoted healthy coping strategies across the graduate students at UTM. So these included training modules on stepped care, harm reduction, health promotion, also inclusive event planning. So I think these roles have not only given me experience in strategic mental health planning, but also it also empowered me to see the bridge between research policy and peer level wellness support in the university. And my lived experience also as a refugee, I came here 2.5 years ago, that also informs my perspective. So having personally faced like some resettlement challenges when I came, housing instability, that also drives me to one of what attracted me to join at Fred Victor, which is a local organization here in Toronto. We do our programs only mainly geared towards folks who are from African, Black, and Caribbean descent and who are in mental health crisis. We do support those folks to navigate the system of the city and get the support that they need. So I am a student of the field. I'm interested in mental health, and I also like helping those who are in the community.
Thank you, Aden. Those are really wonderful perspectives. I'm really excited to hear more about that work and certainly the work that you're doing for Fred Victor as well in those intersections. Sandali, can I pass it over to you? You have a wide range of experience here as well. Learn some more about that work and the work that's also happening with the Mental Health Student Association at UTM. I'm sure we'd all be very interested to hear about that.
Yeah, so I'm currently the vice president of the Mental Health Student Association. My role this year was really overseeing the events we did. In terms of our events, it really had two main focuses. So one of the main focuses was really giving students a space away from academics, promoting wellness. Some event examples would be like we collaborated with the U of T Wellness Den a lot. So we would do like Together Tuesdays where students can just come in, like make bracelets, arts and crafts, whatnot. We also hosted a lot of informative events. We had a lot of panels where we had therapists come in, like experts in the mental health field, and come and like talk to students and inform them and give resources to students. We also hosted a lot of fundraisers this year. With all of the money and the funds going towards like charities that aid towards mental health. So yeah, I think in terms of events, it's all honestly just about like promoting more wellness on campus, especially for students. I think U of T can be a very stressful university for most. So honestly, it's just really giving a break for students. So yeah.
Great. Thank you so much. And I have to apologize, folks. The fire alarm just went off in my building, so it just started happening suddenly while you were talking. So if you hear beeping in the background, please ignore it. I'll take the opportunity, Myra, to please pass it over to you to answer this question as well. I'd love to hear more about the work that you're doing at UTM and certainly the things that are happening at the Health and Counseling Center as well, and how it intersects with student mental health and wellness.
Okay, always unfortunate timing with things like alarms, and so hopefully the beeping doesn't drive you nuts. As Julie sort of mentioned, my role at the Health and Counseling Center is Assistant Director of Health Promotion and Evaluation. So my job is to really oversee the outreach work. So I kind of describe it as everything that happens outside of our clinic doors. And really the goal of health promotion is to empower individuals to kind of take control over their health. And we know, especially those who would be attending today, the importance of mental health as part of our physical health as well. So mental health work and support and resourcing and education is embedded into all the work that we do. And we actually, like my co-panelists, have been involved with the HCC in one way or another through events in our Wellness Den or through our Wellness Ambassador program. The idea of a lot of the work that we do is highlighting the importance of peer-led programming as well, understanding that peer-to-peer connection can go a lot further oftentimes than, especially from an outreach perspective, than we can from a staff perspective. So we certainly do a lot of collaborations with our on-campus partners as well as our off-campus partners, whether informal or formal partnerships, and really understanding that the post-secondary experience for students can be really complex, a lot of transitions and changes. And so that can be really challenging to mental health. And so we really work to try to provide opportunities for students to look at ways to balance their wellness with their academic pressures and needs, because we all know that if we don't kind of take care of our well-being, it's going to impact our academics one way or another anyway. So really trying to focus on having students understand and learn about the ways that they can balance their life in a way that makes sense for them in order to maintain their well-being while working towards their academic success in kind of the post-secondary environment.
Wonderful. Thank you so much. So I want to bring our focus to the attention of the panel today. So today we're talking about campus community partnerships and how these partnerships can support student mental health and wellness, and sort of to couch that in a little bit of back, that, there is increasing demand for post-secondary student mental health services and supports in campus-based settings. That's a demand that post-secondary institutions are working very hard to fill that demand and to meet that demand. But, certainly it's a challenge for post-secondary institutions. And, there's a growing recognition that that type of care has to involve a whole of community approach that not only brings in campus-based supports, but also community-based supports that bring in competencies, training, skills, resources, and access to different communities in ways that can support students both on campus and off campus as well. And those partnerships are something that universities are working very hard to support and develop and nurture, so they can better support their students as well. So each of you has some experience in different ways, either working with community-based partners or intersecting with these partners or developing events or resources, working with those partnerships, and also thinking about how we can measure and sort of assess the effectiveness of these partnerships and what some of the challenges and opportunities associated with these partnerships are. So Sandali, I want to hand over to you first. Through your involvement with the Mental Health Student Association, you've been involved in organizing events, bringing in guest speakers, and doing other types of student-facing work to support students in mental health and wellness. Can you tell us a little bit more about that experience, how that might intersect with community partners, and what types of experiences you've had in that space?
Yeah, for sure. In terms of community partnerships, this was really important, and I think they've been really pivotal to the success of our events and a majority, not a majority, but like kind of half of our events. It was really dependent on outreach. We have an external team at the Mental Health Student Association. So this external team is just dedicated to like outreaching to individuals like within the communities, looking at organizations that are willing to sponsor us, fund us. And I think throughout like our term this year, we've connected with some really amazing professionals. Some examples are just like Nikki Brenner, she was a psychotherapist. Delia, she was like the founder of Get Reconnected Psychotherapy Services. So we've definitely had a lot of experts coming in and talking to the students and sharing resources, and they've all been really instrumental in supporting our work. I think it is a bit challenging at times because as a student club, we don't really get a lot of funding. Like, we're not paid for this role. So there is, I would say, a lack of infrastructure for these partnerships. Like, it's a lot of outreaching, it's a lot of researching, and it's a lot of like building relationships from scratch, to say. And it is time consuming because the leadership changes every year. So there's often like a loss of continuity in some of these aspects in terms of community partnerships. But there was one organization, Krispy Kreme, that has been actually an established organization within the community for a lot of student clubs. They offer donuts at a discount, especially for student clubs that have low funding. So like with this low barrier, we can just buy the donuts at a discounted rate and like use the money for our club and also like to promote charities, mental health charities in the field. So I think like organizations such as this, and I like the ease and the openness of it is something I really hope becomes more common with a lot of the partnerships that could potentially happen in the future. So yeah.
Well, these are really great, important points, and certainly the question, we'll talk about this a little bit later on, about those challenges. You know, you're mentioning infrastructure, continuity, funding, certainly the time involvement. This is work that you and your colleagues are doing on top of your academics and your other requirements as well. And it's work that's really important work, but work that also requires sustained support and resources to make possible. Aden, I want to pass that question over to you. You have experience working as an ambassador. You also have experience working with Fred Victor. And, you know, this is an intersection of off-campus supports and services that certainly intersects with the experiences of students on campus as well. Can you tell us a little bit more about that work and your experiences in the campus community space?
Yes, Ian, currently I am working as a mental health crisis case manager, Victor, and we do support the, as I mentioned before, the our clientele are from Africa, and they do identify as African, Black, and Caribbean, and who are currently in crisis. So those are one of the criteria when we are selecting the clients we are helping. And many of the youth I have worked with while I was with this role are newcomers. Some of them are refugees, some of them are domestic as well, who also began their post-secondary studies, but also quickly faced and compounding challenges. And those challenges could be financial stress, poor housing, and mental health stigma. You know, some of them turn to substance abuse to cope their difficulties. They disengaged from school. They ended up in psychiatric care or criminalized environments. So I think through community support, including like housing and system navigation, some of those students, we were successfully able to reconnect them to their education. And I believe that the link between campus life and the real world stressors is undeniable, and partnerships between institutions and frontline services, and I believe is the bridge.
Wonderful. And that's a really important experience to share there as well, that, you know, we can't think of the experiences of what's happening in campus-based settings in terms of the stressors that students face being somehow removed from community-based context as well, and the stressors that they face outside of that campus context as well, and how they can be overlapping and additive. Myra.
So kind of just to build on that, the kind of context beyond the post-secondary kind of life inside kind of the walls of, in my context, UTM, I think that kind of speaks to the importance of those community partnerships. So within the work that we do, we have both, as I mentioned, on and off campus community partnerships, I kind of say the partnerships, sometimes they're formal, sometimes they're informal, and sometimes they're for the purposes of specific collaborations. And the idea is that it allows us to reach and access a wider pool of diverse resources and supports so students can have access to more supports that might align with their identity, that might align with their circumstances that they're living with at any kind of given point. We do our best kind of within UTM walls and at the HCC to support students and their identities and wherever they're kind of situated in any given moment. And we have the great benefit of being able to extend beyond our walls. And I think a really important part of that is creating those connections for students, because their time in a post-secondary institution will be limited to the time that they're kind of studying there. So creating those connections also allows for transitions hopefully smoother as they kind of complete their time in the academic institution, to be able to then have continued support. Because I think, as Aden mentioned, it's not just what we go through in the academic institution, it's kind of beyond that. So to create that continuity, I think is really important. And again, it expands our reach. We're limited in what we're able to do within the scope of our work and resourcing. So by connecting with others and creating those partnerships, I think it allows us to do more. And it helps create awareness of the vast pool of resources available. I think sometimes there are so many options that we don't even know that there are options, because I think one thing that our health system could do sometimes better is allowing us to be aware as to what kind of services and supports are available. So I think we try as best as we can. Even through the HCC, we have a wellness navigator that is very familiar with resources beyond campus to be able to connect students. So I think the work that we can do to help with awareness as well is really important. So students can, that whole kind of self approach, right? That students can kind of feel that they're supported on all angles. And within UTM, we do fantastic work, and we are able to extend our reach beyond that with the supports of partnering organizations, especially those related to mental health, because that is a big challenges for students kind of navigating this kind of transitional time in their life.
That's a really important point. And I want to apologize to everybody for the distraction here. It is a false alarm, thanks goodness. But I'm very sorry for the interruption to my comments there as well. But Myra, thank you so much for that. And I want to follow up on what you were discussing here at the end. My next question here, has to do with some of the important benefits associated with this. I mentioned this sort of whole of community approach to supporting student mental health and wellness, and why these partnerships are important. And Myra, maybe I can turn back to you to follow up on something you mentioned as well. You talked about certainly extending the reach of our resources and supports outside of the university context, outside of our campuses, to our community-based supports, but also, some of the challenges associated with that. One of the things I'm wondering about, what quite often we hear from students, and I'll pass it to our colleagues to think about this as well, is that understanding, what resources are available, how to access them, ideas around mapping those resources, making them available, and the role of students in driving their access to some of these different resources, particularly in the off-campus setting. Are there things that we can do to improve on that, or to aid students in that capacity, to connect them to those resources? What could the institution do, and how much of that would be certainly within the purview of students to try and address those concerns?
So I think fantastic question. I prior to my role here, I worked kind of in the hospital field for quite some time, and it's always kind of the challenge of how do we know what's available when we're kind of going into the community. I think a really good start, as I mentioned, is we have a role dedicated, our wellness navigator dedicated to helping students kind of navigate their own personal goals. Students don't have to necessarily even come knowing what it is that they need, but that role helps students to kind of figure that out and then connect them with appropriate resources, because it's not just about knowing an organization and what they do, it's how do we access, because different organizations have different potential barriers to access, different requirements, et cetera. And it can be very overwhelming on its own to navigate and access those resources, let alone kind of our baseline when we're trying to find those resources. So I think as an institution, the more we can help connect ourselves to organizations kind of that neighbor our environment and even beyond that, because not all our students, for example, at UTM come from Peel region, right? We have many students who are coming from much further. So the more we're aware and create those connections, the more we can share that knowledge and information with students and empower. For example, at the HCC, we have our Wellness Ambassadors program. We have students that kind of support our peer programming. The more that they understand, the more that they can share. And I think just kind of spreading knowledge as much as possible and bringing some of those organizations into the institution to talk about their programming. We do that in events that we offer when we have organizations come and table and talk about resources, meet with students. We'll have them come run workshops or drop-in sessions just to just for exposure, just so students can kind of learn as much as possible. I think ultimately though it is really challenging because students navigating their post-secondary journey is filled with a lot of competing priorities. And so our biggest challenge is bringing students out to those things to then learn about the existing resources. So I think the more we can do to campaign for, that balance and getting students to understand the importance of learning about those resources available to them, because it helps facilitate their journey and helps support them in the best way possible. So I think as many resources as we are able to provide to awareness and cohesiveness in terms of accessing services beyond kind of our UTM walls would be really important. I think I think about the opportunities, but then my mind immediately goes to the challenges that come with it, because it was kind of my ideal how I would love to kind of have everything really accessible and integrated. And we know that there are challenges, even in our community organizations with resourcing, et cetera. So, and I know we'll kind of talk about that a little bit later. And it's just, I think the more we can connect as an institution and the more we can bring students involved in that kind of connection, the better it'll be, again, as they transition into the community after their time at the institution. I think the more connections we have, the better.
And that's a really wonderful point. And I think that speaks to that generating that continuity of care and service that, doesn't end on at the boundaries of our campuses, that extends to the lives that students have outside. And I want to transition then to you, because, you mentioned in your earlier comments about the overlapping sort of nature of off-campus and on-campus stressors and strains, but also some of the stigma associated, with mental health and wellness and programming and services. So, thinking about these campus community partnerships, in your view, why are these partnerships important? And maybe what are some of the things that, could be done to help students both, navigate and access those resources and services, and maybe also to navigate some of that stigma that you mentioned, maybe from your experiences working with young people in this space?
Yeah, so I think in student life, it doesn't end at the edge of campus. For many, especially international students, newcomers, daily stressors like rent, employment, family responsibility, health history, those things follow them into the classroom, I believe. So community partners, offer services like housing support, culturally relevant mental health care, and at times harm reduction strategies. So, and that universities also might not specialize in for those things. So meanwhile, as also Myra mentioned, wellness programs on campus, like the ones done by the UTM, those things like equip students with tools of self-care, peer connection. So together, I believe these partnerships form a more complete support system that recognizes students not just as learners, but as people navigating complex lives.
And that's a really excellent point. And maybe I can ask you to follow up on an aspect of that. So one of the things that U of T is very fortunate to have is an amazingly diverse student community, with students' experiences represented from across, different contexts and different experiences with life in Canada. And one of the challenges that post-secondary institutions face is providing, in some spaces, culturally competent, culturally responsive services and supports, given the diversity of our community. Aden, some of your work specifically has focused on helping young people from Black, African, Caribbean backgrounds. Maybe you can speak a little bit to the importance of those culturally responsive, sort of culturally competent supports and the role of community partners in that space.
Yes, so you know, the I believe that one of the most pressing challenges is I see in this space is the misalignment in expectation and capacities, whereby let's say the universities, they do prioritize academic outcomes and the standardizing metrics, while the community partners, the ones that I am working for now, they focus more on the long-term sort of person-centered care. And I believe there is also a tendency for institutions sometimes to rely heavily on community organizations without offering a reciprocal support, which will ultimately may create some sort of imbalance or burnout, especially in underfunded spaces. So I think partnerships when it comes to between the community and the institutions must be co-designed with shared leadership between the campus and the community actors. And I believe co-creating initiatives with the community, building reciprocal relationships rather than transactional ones, could be a step forward in the right direction of addressing the challenges that do exist. And especially by doing joint training on anti-oppression, trauma-informed care, and also culturally responsiveness should be the standard. And finally, students themselves, I believe, must be involved in shaping some of the programs. For example, the Student Advisory Committee here at Inlight, UTM's Wellness Ambassadors, for instance. So students can co-create these programs, and the programs can gain legitimacy, relevancy, and impact in the long run.
It's a really excellent points. Sandali, I want to pass it over to you here. So you have really interesting experience working in a leadership position at UTM with your organization, and certainly as a student, you have experience navigating, undergraduate life as part of our U of T community. One of the things that you mentioned in your earlier comments are some of the challenges that you and your colleagues face in the organization, kind of doing this work sort of essentially off the side of your desk. There's additional work that you do on top as well. So I want to ask you a couple of points here. One is just generally about, what you see as some of the main benefits or opportunities associated with having a campus community-based partnerships to support students as well, but also from your experience and maybe things that you've learned from your work, what are some of the challenges that students face in trying to navigate and access these resources, giving all the competing demands on your time and all the responsibilities that you have to face in your work life and certainly in our personal lives as well?
Yeah, for sure. That's a great question. And I think just like backpedaling off of like Mira and Aiden, I think the whole of community approach is really important. I think UTM has a reputation of being known as like a commuter school. Like a lot of students just come in and then they leave right away. I think there is a community, but it's most known as a commuter school. So I definitely do think having these campus community partnerships is really important, since like for some of these students, a lot of their time is spent usually within their own communities or their own homes. And I think if we want to support mental health in a really meaningful way, it can't stop at the edge of campus, as we all probably agree. So yeah, in terms of that, I think it's a really big benefit. In terms of student clubs, especially, I think for ensuring the sustainability of our events and our wellness programs that we promote, I think campus community partnerships cannot only be beneficial to students, but also just very easy on our end. I think a lot of work is done individually, and as students, like outreach is one of our jobs. Like we do have jobs for that, but I think it is harder for us to like constantly outreach and reach out, especially because we don't really know the best organizations out there, or we only just contact like specific individuals. So I think our outreach is very limited, and I think if U of T they have these like really established partnerships and they work with student clubs to help promote that and help work with us, I think it would make our jobs a lot easier, and I think it would make the students' lives better, I think, in my opinion. In terms of challenges and risks, yeah, one of it is the lack of infrastructure, but I think the challenges and risks from these partnerships from our end, since we are doing a lot of outreach on our own, it is very limited. And I was looking through all the partnerships we did this year, and a lot of them were just really therapists. And don't get me wrong, they like all of the therapists and all of the um collaborations we had this year did have a lot of meaningful insights in terms of like our clubs and our events, and I think people really took a lot out of it. But I think a really important question to recognize is like, is therapy, or like are these therapists like a good tool for everyone in terms of culture and whatnot? I think as a brown girl myself growing up, I think therapy was something that was shunned, something that was seen as weak and like not good, and something we should like not go because it's something inherently wrong with us. So I could definitely see with the partnerships that we did, like some students may not have felt comfortable coming to our events or didn't really think our events would be useful for them. So I think in terms of partnerships and the risks with that, just really only focusing on one lens can be really an issue. And though we didn't mean to do that, I think it kind of naturally happened because of the lack of like outreach we could have like the lack of outreach and the lack of partnerships we established throughout the year. So I definitely think that is a risk. And yeah, I definitely do think having a wide range of partnerships is really important, especially for students. So yeah.
That's a really important point. And, stigma around mental health and wellness, stigma that is rooted in different experiences that individuals might bring to the university setting and to their time in our U of T community, and ultimately about culture change as well, which is, in any organization, one of the most difficult things to assess, evaluate, and influence and figure out, how good a job are we doing at changing the culture around issues such as mental health, such as wellness. And, particularly if students, in some cases don't want to have those conversations, I think it's fantastic that there are student-facing organizations where students can interact with peers. Aden, you've been a peer mentor as well, and get times to meet and develop communities with individuals, particularly as that commuter campus that folks might come there and maybe not see themselves getting opportunities to develop strong, mutually supportive relationships with their student colleagues. So certainly that's a broader issue, and that responsibility certainly can't fall only to students to have the agency and responsibility to take that forward. And I want to build on that. So Aden, maybe I can ask you to elaborate a little bit on some of the risks or challenges. You mentioned about alignment, you mentioned about reciprocity as well, and sort of mutually supportive partnerships between campus groups and community-based organizations as well. What are some approaches that we could think of to try to address some of those challenges, or what are some of the things that we could do to make those relationships, as you describe them, to be more reciprocal in nature, and to not only be about, extractive kind of approaches to it, but also about capacity building for our campus-based supports as well?
Yeah, I think that's a great question, and I think in terms of I think there has to be a shared kind of leadership among the community organizations and the camp and the campus actors, and those challenges. I see a risk of tokenism when partnership is at times include community groups just for the optics without including them in the decision-making process. So I would love to see more hands-on, whereby the community actors are given the chance to have their say on issues that are surrounding and health and wellness, and also serving the community, especially focused that are vulnerable.
And that's a really important point. And one of the things that Inlight prioritizes in our research and support work is centering students as, key stakeholders and partners from the inception and development of different research projects and initiatives, and recognizing that student experience and perspective has to be centered to this. And, Aden, as you mentioned with our community-based partners, the involvement of community-based partners can't be about tokenism, as you mentioned here. It has to be about being equal partners and being brought in the decision-making process, the design process. And Sandali, you spoke to this to a degree as well in your comments. Myra, could I pass this sort of question over to you about some of the challenges or maybe issues that might be associated with these partnerships, and how might we think about addressing some of those challenges that might come with forming these partnerships and sustaining these partnerships as well?
I think some of the challenges, I'm nodding my head as everyone's talking because I very much agree. And I think this has been my experience actually across my whole career. I think that there's kind of the goal and then the reality. And I think a lot of the challenges too with partnerships come with differing priorities, differing resources. Resourcing can change, especially with community-based organizations. Sometimes their funding isn't consistent, their staffing resourcing isn't consistent. So being able to have meaningful collaborations and partnerships can sometimes be challenged in terms of having consistency. And I think Sandali mentioned that earlier, just even in terms of with student clubs and kind of changing leadership year over year. I think that happens beyond that as well. And kind of the resourcing that's in flux makes it hard for those sustained partnerships. And when we have things well beyond us, like governments changing priority and funding changing priority, that can change a lot. So I think resourcing and consistency becomes a challenge. And then from our perspective, that awareness piece and that cohesiveness in the healthcare mental health system, really being able to understand the available resources so that we can connect to them and then connect to them in a sustained way. And I very much agree with Aden's points that concern around that tokenism. And, we want to meaningfully engage with partners. And in order to do that, you have to start together from the beginning and you have to maintain that through the whole journey. And that's where those added challenges that I was talking about kind of can interfere with that sustained journey. So in order to kind of get those strong partnerships, maintaining that through, I think is the ideal. I think sometimes we do get those challenges and then you end up having partnerships that take more one-off, like help for, so support and engage for a year, but then that changes and kind of ebbs and flows is the challenge that then becomes a bit of a risk because then we can't adequately assess how well are those partnerships working for us and it's not working for us, it's working for us in the interest of supporting students. So how well are students benefiting from those partnerships? And that's kind of the added challenge. How do we assess when we partner with an organization, whether students are finding that helpful and whether they're able to get what they're hoping for out of those organizations kind of being present on campus or those connections? Do they support students through those transitions? So I think those understanding the why and the how and all of that evaluation kind of lens on it becomes an additional challenge because to do that effectively, those partners have to do that together because I can assess on my end, do students find it helpful when they learn about resources kind of and get those more simple qualitative or quantitative measures. But then the real help would be if we can understand whether there's a connection then into those community organizations. Are we able to understand the whole journey for a student as they connect with on campus and off campus support? So I think that piece as well becomes a bit of a challenge, especially because from what I hear from our students in our HCC Student Advisory Committee and kind of beyond, there's also survey fatigue and students get asked a lot of questions all the time. So how do we ensure that when we ask a question, we're asking it meaningfully and also being as low barrier as possible? So a lot of the work that we do, we don't take identifying information so that we kind of maintain that low barrier. And if I want to be able to understand the effectiveness of partnerships, I probably do need to take some identifying information in order to kind of assess that journey. So long-winded answer, I think there are lots of layers of challenge, and beyond that, it's still kind of worth the journey because I think that what we stand to gain from embarking upon those partnerships and that work together, that collaborative work, is kind of worth figuring out how to get through those challenges because ultimately we need that whole community approach for everyone at every phase in their life. And the post-secondary journey is a unique one. As students kind of transition out of certain types of kind of youth programming into adult programming, and there's kind of always a little bit of a gap in terms of services. So I think the more we can support students in navigating that, the better the outcome, especially from a mental health perspective.
Absolutely. And you've covered my last question, which is about thinking about evaluating and assessing sort of the effectiveness or the outcomes of these programs. And, in my experience working with community-based organizations, there's a constant demand for evaluation data. There's a constant demand for organizations to develop capacity in evaluation. And there's the real question as well, about when students, complete evaluations or provide us with data, they're entrusting us with their data. And it's a very serious responsibility with that data to make sure that it's being used for the right purposes in an equitable way, and to ultimately improve student outcomes. It's not just collecting data for the sake of collecting data. And that involves transparency and students as key stakeholders, as knowledge users, but also in determining how that data might be used, applied, analyzed, and disseminated as well, which is it's a tremendous responsibility. Aden, can I pass this question over to you? What are some metrics or what are some outcomes or what are some things that we should think about when we're thinking about evaluating the successes, benefits, challenges, and opportunities of these campus community partnerships?
Yes, I think success should be evaluated through a mix of traditional metrics like, for example, reduced emergency visits when we are serving community, but also increasing surface uptake and meaningful qualitative feedback. So what's important to ask is that did the students feel heard? Did they gain stability, for example, or have they been reconnected to their studies? Focus like who I think sometimes get lost into the system. So at UTM, I think we evaluated our ambassador programs by reflecting on student engagement, the relevance of the workshops that we have done, and how well we addressed the graduate-specific pressures. And in community settings, progress can look like securing housing or reducing the crisis interactions. So these outcomes may not show up on institutional dashboards, but they are, I think, life-changing for students.
That's a really important point, that a whole of community approach might also entail then a whole of community evaluation process that considers not only successes in terms of campus and academic life and feelings of engagement and belonging with our U of T community, but also navigating challenges and issues off of campus as well, because that is a direct contributor to our experiences with campus life. So we have just about a minute or so left. Sandali, I'm going to pass this last question to you. I'm just going to remind folks that if you have questions, please hop into the Q&A function. We would love to hear your questions and share them with our speakers. Sandali, last word to you on this about how do we think about evaluating the successes? What are some of the outcomes or things that we should look at and think of these partnerships and their effectiveness?
Yeah, that's a great question. In terms of like student clubs, like I feel like a really big metric we use is like, oh, how many people showed up at the event today? Was it 50? Was it 100? Was it 2? Was it 10? And I think we really harp on like, oh, we need to get the most amount of people to come, like we need to advertise, we need to push marketing. Like I feel like that's a very big like culture around student clubs. Like we just want like the highest number of attendance, and that's how we kind of measure success. But it's interesting because we did have a panel like MHSA like near the like I think it was like near midterm season, near exam season, so it was like not a lot of students did show up, like around 5 or 10. But at the end of the panel, like I saw the students trying to connect with the speakers. They came up to us and they were really like happy that we had an event like this. They seemed really curious. They seemed really excited about it and like willing and wanting to connect with the speakers after. So I think really looking at, okay, like are the students being heard? Like do they feel heard, like Aden said? Just yeah, I don't obviously like we want the most amount of students to feel impacted, like in terms of metrics. I think that's really important, but also just looking at if one student was felt heard today or felt seen or used this resource genuinely, like that's always a win, honestly, in my books. So I think really just like numbers are important, but it's also just looking at like are students really using this resource? Are they reaching out? You know what I mean? Um, yeah, that's my take on it.
No, that's a really great point. And, as anybody who does evaluation work, there are different approaches to evaluations. And sometimes some approaches don't necessarily always capture those success stories, those small success stories, those individual success stories, but they're incredibly valuable if it's impacting the experiences of a small number of students and maybe in ways that we don't anticipate. Those are still extremely important and things that we need to consider in terms of assessing the effectiveness of these programs and what can we do to strengthen these programs, improve them, and better align them with the needs of our student community as well in supporting their mental health and wellness. I'm going to take a look now at the Q&A function. And we have one question here in the Q&A function, so thanks very much for that. So the question here goes out, when doing evaluation on mental health promotion outreach programming with students outside of participation numbers, what qualitative evaluation questions does the student panel feel are most meaningful to inform experience with resources and events? And I'm happy to open it up to the first person who wants to hop in on this question. Please go ahead. And I'm happy to restate it as well. So, what qualitative evaluation questions in terms of evaluation of promotion of outreach programming with students, what qualitative evaluation questions does our panel feel are most meaningful to inform experiences with resources or events?
I could go first. For events, we do have a lot of feedback forms. So it's like after every event, we'd like to give out a form to students and be like, hey, what did you like about this event? I think in my eyes, the most meaningful questions are like, what did students not like? Like, what did they not like? What did they want to see differently in the future? Because I think we can get a lot out of that as well. So I definitely think looking on like how can we improve? What did they not like? What can we do better? I think are the most meaningful ones because I think it gives us the most insight. Like everyone could say, oh yeah, I liked the event, it was great, but like what can we do to make it better, more inclusive, whatnot. So yeah.
I can
Yeah,
share as, oh, go ahead, Aden.
Thank you. I can also add on, some of the questions that we can add. It's like, can you describe a time when you felt supported or unsupported in managing your mental health at the university? What barriers have you faced in accessing mental health services, either on campus or in the community? How does your cultural background or lived experience influence your comfort with accessing mental health support? International students form UFT, I think 1/3 of the student body. So I think the cultural background, the lived experience also, I think is crucial when assessing.
Every time I go to click my unmute button, it just doesn't cooperate with me. And just to add, thinking about the health promotion kind of outreach work and how do we assess, when we run events and we have resources and maybe many workshops, etc. We kind of have, our more standard quantitative, but from a qualitative perspective, even asking like, what do you feel is the most important thing you gained from your experience today? And just trying to get the individual's experience of the event and what they gained. And when we kind of go through that information, we start to see what is it, the resource booths that they engaged with? Is it kind of when they sat down and were able to do something hands-on, and we are able to then kind of tailor based on feedback from that as to where should we be putting more of our energy as we kind of plan new events and initiatives, and kind of where the preferences and needs are, and just kind of more open-ended feedback questions. One thing that through some work like I've been doing this year and kind of working to overhaul our health promotion evaluations is also looking at understanding students' experience of belonging in the space. Because that's also a really important piece that we haven't figured out the right way to kind of ask those questions to really, we can ask, did you feel like the event was inclusive, but how someone defines that, etc. And it can feel a little bit vague. So really trying to get at a sense of belonging for each individual is something we're kind of working on as well, because it's not just whether you're gaining the knowledge, but do you feel that these spaces that you enter in include you, make you feel safe make you feel like you belong as part of that community, because as we try to build those partnerships with external organizations, so in and outside of those walls, that sense of belonging, I think, is a really important piece, and it actually comes up quite a bit as part of our student advisory committee as well, that wanting to feel part of a community, and whether that's the UTM community, whether that's their broader community, those that associate with their identities, etc. So I think getting at that belonging piece is really helpful to us too, because we want students to learn and to kind of be empowered with their own physical and mental health, and we want them to feel part of a whole, which we all know kind of feeds into our mental health and our well-being as well. So I would say that kind of belonging piece, in addition to kind of what did you gain, and not putting any of our kind of judgments or perspectives on it and leaving it really open-ended, has been really helpful to us, because it helps kind of challenge our assumptions that we have as we go into kind of planning initiatives. Hope that helps, Johnny Lynn.
It is a wonderful point, and it's a wonderful way to wrap up our comments today. I want to thank everybody as well. I'm going to pass the baton over to Kristen, who's going to take us out to wrap up our session.
So first off, thank you, Julius, for organizing this, and for Myra, Sandali, and Aden for being on the panel. This is wonderful. Some great food for thought as we move forward with supporting some evaluations, both at the University of Toronto and then designing research with partners around the world. This has been really excellent. I just wanted to let everybody know that the recording of the video will be available and sent to everybody that registered. Please provide feedback on today's session. It's an ongoing session that we do take recommendations from attendees to put together future speaker series events. And if you'd like to know more about this speaker series or our partnership within the student mental health space, please go to our website, which I think someone put in the chat just now from our team. And we look forward to having you at a future event. So thank you, everyone. I think there we go. Thank you, everyone, for attending today.
Wonderful. Thanks, everybody. Thanks again to our panelists and to all our audience for being here as well.
Thank you.